Sans, can we do the approval of the minutes beforehand, or should we?
I think we're supposed to go right to nominations and elections.
Okay. So, what we will do.
You need a motion to move election of officers. We've been advised that the elections of officers has to go up front of the meeting. So we've been advised to move that up on the agenda. So there would need to be a motion to move the election of officers up to the front of the agenda.
Right, and actually, since we're being a little bit more formal than we usually are, why don't we start with a roll call?
Sure.
So that we can see who's here officially. I know it's a little different, but why don't we go ahead and start? My name is Dr. Henry Yoon, chair of the board, and I'm just going to go the names of the that were on the minutes. So Ms. Connolly, is she here? I don't believe so. Mr. Steno, are you here?
I'm here. Sorry, my camera is not on. I've been in COVID clothes all day with a scrub cap and everything. So I'm here, but you're not going to see me because I look like a mess.
Ms. Durgee, are you here? No, I do not believe so. Dr. Hotchkiss?
Yes, I'm here. Hi.
Dr. Morosa, are you here? I see you.
Yes, I'm here.
Ms. Vitale, are you here? I don't see her. Also, Mr. Cleary is here as a guest. Ms. Mitchell is here as a guest, and Ms. Flynn as the recording secretary, or excuse me, health department secretary. All right, fantastic. So as Sans had mentioned, that we were going to, if I could get a motion, please, to amend the agenda so that we can begin with election of officers.
I'll make a motion to change the agenda so we can.
Thank you, Dr. Hotchkiss. Can I get a second, please?
A second.
Dr. Moroz, thank you. Second. All in favor, say aye.
Aye.
Thank you. Any opposed or abstentions? Okay, motion passes 4-0. I sound so official. So we'll, all right. So at the end of the year, we take this time to elect our officers for the following year. We've got 3 positions that are up for election. There's the chair position, the vice chair position, and the secretary position. Traditionally, what we'll do next is take any nominations from the floor for anyone who'd like to nominate themselves or someone else for any of these positions. And then what we'll do is, depending on whether there's more than one nomination for a particular position, we'll go and just vote in our new officers, and then the chair will take the meeting from there. Any questions? All right, so I'd like to open the floor for nominations for the position of chair. I will self-nominate myself, which I do accept. Is there anyone else who would like to nominate someone else or self-nominate themselves for the position of chair? All right, hearing none. Can I get I guess we should vote then. So all in favor of myself, Henry Yoon, as continuing on for chair of the Board of Health next year, please say aye.
Aye. Thank you.
All right. Any
Thank you,
opposed?
Henry.
Any opposed or abstentions? Okay, great. Thank you. Did someone else join the meeting?
Andrea, is that you calling in on a different line?
No, that's not me. Someone is caller user 3.
Okay. Well, we'll wait and see if they.
Carolyn.
It is Carolyn. Okay.
Hi, Carolyn.
Hi.
Hi, Carolyn. It's Henry. We are in the process of voting or electing officers for next year.
Okay.
We just voted myself as chair for next year.
Good for you.
I hope you have no objections. All right, so from here, we'll open the floor again for nominations for vice chair for next year. Do I
I
hear any
nominate
nominations?
Eva again. Eva
right.
has that position. I nominate her again for the position.
Thank you. Dr. Moroso, will you accept the
Yes,
nomination?
if there's no one else that was wanting to step up for it, I will gladly accept.
Okay. Is there anyone else who would like to nominate either yourself or someone else for the position of vice chair?
Just
Hearing
I just
none?
got on the meeting. This is Sally. I'm just got on the meeting. I'm late. I'm sorry. I just was having a problem with the WebEx because my son apparently had to reinstall Windows and everything wasn't here.
Sounds like me.
I'm sorry. I don't know if you could fill me in quickly, but
Yep. No, absolutely. Well, actually, we're in the midst of electing officers for next year. So I've been elected to chair again next year. Dr. Morose has been nominated for the position of vice chair. And we are about to vote. So
okay.
all those in favor, say
Great.
aye.
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 Great.
Aye.
All right. Thank you.
Aye.
All right. Any opposed? Any abstentions? Great. Congratulations, Dr. Morose.
Thank you very much.
And lastly, we have the position of secretary. So I'd like to open the floor for anyone who'd like to either self-nominate or nominate someone else for the position of secretary next year.
Can I ask a question?
Yes.
I'm a liaison from the Human Services Commission. So do I actually have a vote on any of this in terms of, chairman, vice chairman, or however you want to put it?
Yes. Yes. You are a full voted member.
Oh, okay. Thank you.
All right. Any other questions? Okay. Any nominations for the position of secretary?
I nominate Dr. Hotchkiss.
Dr. Hotchkiss, do you accept the nomination?
I accept.
Thank you. All right. Well, then why don't we go ahead and vote? All those in favor of Dr. Hotchkiss holding the position of secretary, say aye.
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 Great. Any opposed?
Aye.
Any abstentions? Great. Thank you. Well, congratulations to our newly elected officers. All right. So, Sands, are we going to continue? That was it, right? We were going to just move on from there.
That's it. We just moved that one thing per the Robert's rules. We were advised to move that one thing up forward, and then we proceed with the regular meeting.
Great, fantastic. In which case, we'll move to the minutes, approval of the minutes. Hopefully, everyone's had a chance to look at the minutes from November 9th. Does anyone have any comments, edits, questions, concerns, objections? If not, if I could get a motion to approve the minutes.
Motion to approve. It's Sally Connolly.
Thank you, Ms. Connolly. Can I get a second, please?
I second.
Seconded by Dr. Hotchkiss. All those in favor, say
Aye.
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 Any opposed, any abstentions? Okay, fantastic. Motion passes. Why don't we move forward to our reports, our Director of Health, Mr. Cleary.
Sure. Okay. I am going to share my screen and give a quick update on some of the numbers. Just take me a second.
Let's just get to
I had actually had all these web pages ready to show you, and then I got it all set up this afternoon at work. And then when I went to log in through the VPN to my work computer to do it, it actually it doesn't work. There's no mic, no, it doesn't recognize the microphone, and the camera I had actually put down on my desk, so the camera view was just about a few pencils on my desk. So I had to quickly switch to this computer. So I thought I'd show you something, give you a little behind the scenes of what's going on. So I had to quickly pull up some websites that I was planning to show you, but I can't remember all of them. But so this what I'm showing you right now is actually the CDC's Vaccine Administration Management System portal. And so this is the system. And so because we have been spending, the bulk of our time, Jill, myself, Mary Ellen, our public health nurse, one of our staff that has been hired to assist Mary Ellen in running the clinics, vaccination clinics this year, we have spent a significant amount of our time last month doing participating in 3 to 4 meetings per week on planning efforts to begin to be ready to deliver COVID-19 vaccine. And so this is the system that CDC developed specifically for this. And one of the requirements of CDC is that there be single dose accountability of every dose of vaccine. And so this is the system they designed to do it. This is a system we are required to use unless we have some kind of integrated, what's the correct term, Jill? I'm drawing a blank. The electronic medical record system, EMR. Unless you have an integrated EMR that integrates with the state already, you're required to use this VAM system. And so what this allows you to do, and I'll scroll real quickly through the tabs here. So essentially when somebody arrives, the default screen here is what today's appointments at the clinic, and you would check in your recipients here. It enables you to scan in via the barcodes on the inventory that you receive, to scan in the inventory. That'll populate based on the barcodes that are on the products that we receive. And then it automatically deducts from inventory what our current stock is. We can place inventory requests through the system, and you'll see in here that we've already submitted a inventory request for 500 doses of the Moderna vaccine that we're waiting to see. It enables you to pre-input all the users that will be potentially using the system, being vaccinators or front desk folks checking people in, or inventory management, or clinic managers. And so you can see here we have to date 47 of our staff pre-logged into the system, ready to work in clinics. And then it enables you to, this enables you to give certain permissions for different levels, whether it be front desk, where people will be predominantly checking people in, whether it's a healthcare professional that'll be doing vaccinations, and clinic admins for a few of us that can add people and edit things. And so we have most of our staff in there already. We're working on volunteers in there this week. And then it enables you to set up your clinic status, like your clinic details, including setting up, like, we're a clinical provider. We receive it at receive our vaccine at the main clinical deals. Then we do individual clinic setups here. And then it gets down to the level of, how many treatment stations are you going to have in that individual clinic? And so we'll set those up here based upon when we have a clinic, and we're starting to do the work now and again, this is just this is just a potential clinic that if we are to receive the requested vaccine, we're planning on having a clinic next week. And so if everything goes well, we will move forward with that. But again, this is just a tentative date, and it's it's set up not to be visible, not to allow anybody to schedule things. So I just thought I'd show you the VAM system that we've had to learn and be prepared to use. And so for us, you know, vaccination is something we do robustly every year. We do, you know, usually around 2,000 vaccinations every year, including all the different types of vaccination we do. And we do it, we typically, just to keep ourselves in training, is we do it in a condensed format in a mass vaccination type scenario, so that we challenge ourselves to always be familiar with how to deliver a lot of vaccines very quickly. You know, like for example, like today, you may have heard on the news that Connecticut was started to roll out their first vaccine today at some of the healthcare systems. And I was surprised to learn, you know, that one of the healthcare systems, yes, you know, we started delivering vaccinations today, and was asked how many they did, and he said, "Oh, I think we did about 15 or 20," which I was surprised that you know, having that vaccine, that's what they that's all they vaccinated today. But this VAM system is fairly complex and has new features that we all aren't familiar with. You know, for example, this year every vaccination station will have a Chromebook with a barcode scanner attached to it, that essentially when they arrive at the vaccinee arrives at the vaccination station, they will essentially, they'll already be in the system because they've been scanned in before by the front desk folks. And then, but when it comes to the individual nurse that's signed into that particular station, will deliver the vaccination, then scan the vial to connect that vaccination to a lot and dose number. And so it's a little bit more complicated. And in addition, that they're recommending at least a 15-minute wait time after this vaccination. And we heard today from one of the calls with clinicians that, you know, for those with allergic reactions previously, that it may be up to a 30-minute wait time. Impact our clinic pattern and design a little bit, but we're working to address that. So that's the new CDC system. That's what we've been working on a lot this past month, and understanding it and getting signed up. It's layer and layers upon clinicians, all the other aspects of approvals that Jill and Mary Ellen, our public health nurses, were working on, getting us to the point where, you know, every aspect of it has to be reviewed and approved by the state. So we are, as of, submitted our last thing, and we just have a sort of self-training video that the vaccinators have to watch, which was distributed today, and then we are set to go to receive vaccine. So any questions about VAMs or mass vaccination?
Could a couple other people mute? Is anybody else getting little sound effects? I think we just need a couple more people muted.
And hearing a few little things there, yeah.
I think that may be Carolyn.
Oh, Carolyn's on the phone, yeah. Okay. So moving on, let me pull up. I would show you our data page here, where we are, 2631 total cases, currently 165 deaths in Fairfield. And to show you some of the comparisons where we are now between over here, you'll see spring. Here you'll see the fall cases. That's by date reported. Here's what's happening with the cumulative cases. Sort of, you know, you'll see this gradual increase here, and then leveling out for the summer months, late spring and early summer months, and then this steeper increase in total cases. Here is the similar graphic by specimen collection date. You'll see the sort of magnitude of difference of what we're experiencing now. There's this sheer number of cases is significantly greater than what was experienced in the spring. just with the size of that. And so we're starting to see, some, we're cautiously optimistic that we're seeing some leveling off here, sort of for the last month or so, but, a lot of the models still show potential increases on the way. So we don't want to be overly optimistic. Just thought I'd show you some of the unique variables here, what's happening here sort of over the summer. The age level in early fall had been, around 21, the median or average age had been sort of down here, and now it's really coming up to be where the median age and the average age are both around 50 right now. So we're seeing a change in who's being impacted now, as opposed to last spring. We're up around 72, 75 years of age for cases. As the universities have gone home, naturally the university population of cases is shrinking each week, with the general population making up about 60% of cases, elder facilities about 15%, and the remainder of university populations. And this breaks it out in terms of the three bars represent general population, elder facility, and university. And you can see we had this peak of the sort of outbreak week of that Fairfield U and Sacred Heart experienced at the same time. And then the university cases have steeply come down, while the light blue cases is the general population. You see this curve just kind of slowly going up, 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 up. We do have this lower rate here, but that still may have some data to be reported. In terms of deaths, we're seeing, 89% in the general population. In the elder facility population, 11% in the general population. And you can see here the distribution of deaths over time. Here's in April what you saw in terms of, this is just number of deaths per day reported. And while we're not seeing some of those high peaks yet, we are seeing, an increase in the number of deaths being reported, with the few being reported this week. So we're hopefully we won't see what we saw in the spring, because there's better controls in place in long-term care facilities and better treatment options available in the hospital settings. And then I'll keep going down to get to here. So just what we're seeing in terms of, number of cases just continues to increase in terms of this, the first rate cases per 50,000, and Fairfield and the state are pretty even there. This is the greater Bridgeport area, with Fairfield being the light blue line, where we were consistently down below everybody except for Monroe, but now we're kind of joining in with the group of everybody here except for Bridgeport. And this just shows sort of magnitude of difference for hospitalizations between Fairfield County and Connecticut, between the spring peak and what we're seeing right now in the fall peak here. So thankfully it's not as high. Again, we're still, some of the models think that we'll be continuing to see increases in cases for the next 2 to maybe 3 weeks. And then this last one I'll show you is this is admissions and discharges in the hospitals and by day. And so you'll see in the spring we had this large increase of admissions. Then we saw a series of discharges where the numbers went down, and over the summer kind of evened out. Then again, we've seen this large increase in admissions, and we've started to see a few days where discharges outweigh admissions. So still early. Even the state has a similar graph on their webpage that they caution of interpreting it too early. So we'll switch to our school data page, and just showing what's going on in terms of the school metrics. The leading metric here, cases per 100,000 per population over the last 2 weeks. The state and county continue to rise. Fairfield saw a little dip. This is somewhat of as a result of, this is representative of the university cases have any impact. Then the university students left, and you can see our numbers kind of leveled out a little bit below what the state and the county are experiencing, which we're happy to see that it's lower. Percent positivity, we're seeing Fairfield is a little bit lower than the state and the county are currently experiencing. This is slightly older data. This gets updated once a week by the state. So right now, the state has come down to around just a hair over 6%. Again, showing hospitalizations just continuing to climb for the state and the county. COVID-like illness in the ERs continuing to climb with some this last 2 weeks showing some sign of leveling. And this is the one I wanted to really show you. And you can see here, this is the scatter plot of school-aged children. So this is children under 18 and what's happening in school-aged children compared to, here's the spring going on, then here's some of the clusters that we had over the summer. And then this is really, just all this last month or so of activity where we're seeing just a lot more activity among school-aged children. A lot less when you can kind of see a line at 10 and under is a lot less activity than what's going on at the older ages up here. But it's definitely, you can see the difference between the impact on school-aged children between spring and summer and now. And so that is what I was going to show you there. Go over to the school dashboard to show you, we currently have 39 confirmed positives among school students and staff. We've got 117 staff that have 217 staff that have recovered. I'm looking over at this dashboard over here, excuse me. It doesn't expand. And we currently have, over 280 staff and students in quarantine. So this is the work of, Jill. Jill is, every one of those numbers has Jill's tears and sweat associated with it, as well as our contact tracers in terms of the demands that this places on the contact tracing staff to make sure, every time there's a case presented, that we are working very diligently to ensure that any contacts are notified quickly and do not end up in the school system on subsequent days. And so this is a great deal of work. And I'll pull up one other thing that I was going to show you. I get this pull down thing that comes in, gets in my way. All right. Go back up to our data page. And a new page that we did that the staff wanted to post was this one, which is on our main data page, but it's just showing you sort of the fall and winter to show you sort of what's been happening, taking out the spring data. So it sort of condenses things a little bit, show you kind of like where we've been by, cases by date reported, cumulative cases, this gradual increase, cases by specimen collection date. And you'll see this large peak here, and then this kind of somewhat level case here of cases. This is in town here, with the trend line showing a somewhat downward trend. The cases by university population. So that's just for this fall. University represented 34.4% of the overall cases, with the population being 60. Kind of shows you a little bit clearer on what's going on with this graph in terms of elder facility, university, and general population. So the staff just wanted to break that out to make it a little bit clearer what's going on just this fall. And so that's somewhat the local data. And then I thought I'd just give you a quick show of the state data. Just thinking. And state is, they're still seeing increases in hospitalizations, 33 hospitalizations. That's a 3-day result. This Monday reports represent the weekend. 81 deaths over the Friday, Saturday, Sunday. And so we're still seeing those increases, but For example, the governor said, Friday we saw a decrease, Saturday we saw, I believe, a decrease in hospitalizations, and then Sunday it was, 60 some odd hospitalizations to sort of counter admissions to kind of counterbalance the decreases that we saw. But I want to show you some of these, here's confirmed and probable cases over time, that what the state is seeing now. Again, these last ones, as more data comes in, they can sometimes be impacted, but you see the trend up into this peak here. It's kind of in an upward trend. Hospitalizations overall for the state, you'll see not quite, kind of looks very similar to ours, not quite as high as in the spring, but getting up there. Deaths as well. Similar specimen collection date, trending upward. Then just well, I was going to show you, but that's not what I want to show you. Yeah, just this, I found this one interesting. This is on the state site today, looking at from a state perspective, that children 20 and under, the total number of cases were at, a little over 20,000 there, which is, less, greater than what's seen in the 70 and above overall for the, entire duration of the pandemic. Interesting. I hadn't sort of seen that visual display to see that, the lower age groups are being impacted, and that, is reflected in the median and average age line that I showed you, where that, for a long time our average age was down around 20, indicating that, a good portion of those are below that. Our low median was at around 20, and so about half the cases are below 20, and that's sort of reflected in this. If you look at this last spring, these bars were almost non-existent. So that's sort of the data presentation.
Sans, just
Yeah.
sorry to interrupt, but while you're on this, do you mind doing the drop down, since you have it there, to the total number of deaths on that same graph by? Oh, that's somebody called in.
Yeah, Rick Brower here. I was wondering if you had a call in.
Hi, Rick. I think you're probably in the wrong meeting. This is the Board of Health meeting.
Okay, sorry about that.
That's quite all right.
I was like, I promise it's not my kids.
And so, yeah, this, if you go
okay.
to the state site, this has some great functionality, to be able to sort of switch that around. But yeah, so the deaths, we're still not seeing, significant impacts of deaths in the lower age groups. So then I just thought I'd move on to some of the general issues. So, Jill and myself and the staff continue with our regular meetings. Every week we have multiple meetings with, 2 with DPH on general updates, 1 every week with the CDC, 1 with the State Department of Education, 2 state meetings specifically focused on mass vaccinations, 2 governor's press conferences, and there's a weekly municipal conference call with the governor's office for towns. So that's sort of the background of activity of what we do, and then we're still, we still have to do the business of the town. So we've started our budget preparations and getting ready for this year's budget cycle. We continue to meet with the Fairfield Road, Fairfield Beach area homeowners associations and the Fairfield University, talk about issues down there. In terms of mass vaccination, I heard a stat that I thought I would share in the governor's press conference today. He talked about, and I had a couple great slides from the governor's press conference, but they are on my work computer. That the one that wouldn't let me hear or see you, or you couldn't hear or see me if I went through that VPN connection. So, but he had some great graphics of where the 16,000 doses that were received this week, and where they were distributed throughout the state, and showed essentially that we hope to have within the first 2 weeks about 120,000 doses of vaccine coming in. And that second week, that week when we receive the Moderna, is where the state is really pushing to get it into the hands of, you know, it'll go to the hospitals as well as long-term care facilities, but we'll also get out into the FQHCs, the federally qualified health centers, and to the local health departments so that we can start vaccinating individuals locally. And so we've already, essentially through the VAM system, people enroll as employers, and then they upload their rosters of people that are eligible for vaccination. And in that process, they search for local clinics. And so we're working to have a local clinic available for them to attend, so they don't have to necessarily go to their to the hospitals, and the hospitals have a busy time vaccinating their own full-time staff. Not to mention they're also expected to provide vaccination services for all medical practices in each of their catchment areas. So it's a challenging ask for the hospitals. So the health departments are coming alongside them, along with the federally qualified health centers, to assist in vaccinating this phase 1A group of healthcare workers, long-term care facility, and medical first responders. So we will be part of the team doing that. And so talking about the Medical Reserve Corps, so for those of you who are newer, we have a 350-person member Medical Reserve Corps for the town of Fairfield, and we sent out a recent email over the weekend to our volunteers to recruit individuals for a couple of different functions. And several of you are in the MRC, so you may have gotten the emails, but essentially to supplement our staff with even things just as things like assisting in our office to answer phones, assisting with contact tracing, assisting with call centers should the need arise to set up call centers for prioritization questions, which we're starting to get a lot of now. But so we had about 30 individuals from the Medical Reserve Corps sign up that they want to assist. 9 of those signed up for the regional mass vaccination strike teams that are being organized in the region to assist towns with their vaccination efforts. And so in that, the Stratford Health Department, who's taking the lead on the regional strike teams, is conducting 2 trainings for those individuals, which started last Wednesday. So we went through one training with them. There's a second half of that training coming up this week, where we'll continue to work with them and try to get the vaccination strike teams up and running. And then in Fairfield we'll have these 9 volunteers that'll be part of the team, but Fairfield, because of the nature of having the nurses, school nurses, as a part of our department, we have ample staff that is very excited and willing to assist in the vaccination effort. And Jill's doing a great job of all the surveys and questions and everything that needs to be clarified about making that happen. I've had now that they've changed the ordinances or the state laws a little bit to allow for local health directors to give the loyalty oath to Medical Reserve Corps members. I've been asked on 3 occasions now to administer loyalty oaths to local Medical Reserve Corps. And so I've had 2 for Sacred Heart, and another one for St. Vincent's Nursing School apparently is going to be part of that as well. And so it's interesting to be called in for that. That's been reserved for EMDs, emergency management directors, and the town clerk. And so anyway, that's sort of a bit of what we've been up to this past month in terms of getting up. Our priority is really to focus on contact tracing efforts to protect the schools and the community, and to be ready to receive vaccine. So we hope to be one of the early health departments receiving it and actually getting shots out and into people's arms and starting to put an end to this pandemic. So I will conclude my comments there, unless there's any questions.
Great, thank you, Sands. Does anyone have any questions for Sands? No? Okay, great. We'll move on to the Assistant Director of Public Health Nursing, Jill.
Okay, thank you, Henry, and thanks, Sands, for that. Really, I don't have too much to add. We really have a unified effort with the actual health department with Sands and what the nurses are doing in the school. Contact tracing is an enormous job, but it's close to 24/7 trying to prevent children, number one, those who are positive from being in school, and number two, get the children and staff who need to quarantine out of the school. But I have to tell you, the communication between the nurses, my office, the contact tracers, and the school staff, especially the principals in all of our schools, has really been exemplary. And I think it's really helped us so much to have an effective effort here. And aside from that, the nursing staff is thrilled to be a part of this immunization effort. And our focus right now is just to get them, well, up on the VAM system. And of course, we have all sorts of access to training manuals for administrators, clinicians, front desk personnel, and that's going out to everybody. And I'm sure there'll be more questions, and I'm sure it will be a bit of a learning curve, but I think they're more than up to the job and really, really anxious to get going on it. And really, Henry, that's about it. This has really been it. November and December are usually quiet months in my office, as it is that there are no big deliverables for the State Department of Education. So we're just kind of tooling along with this at this point.
Great. All right, thank you. Does anyone have any questions for Jill? Yes,
I have a couple questions.
Sally.
Well, one thing I did, just with some of the potential decreases in quarantine times is that going to come into play at some point potentially based on some of the higher, information we've gotten from the CDC?
Well, what has happened is that the State Department of Health has taken that information from the CDC with the 7 and 10 day quarantine, and they've made their recommendations. They've sent those recommendations to the governor's office for his review and approval. They did not give us a hint as to what those recommendations are going to be. I mentioned earlier, we were just talking before the meeting started, that I hope there'll be some decision from the governor's office that will be announced tomorrow. But, I was hoping for that last Tuesday. So I can't tell you more than that.
Okay.
We do have plans, particularly for those people who, the in-school quarantine. We have told people that, if, a change is made, it will be announced on our social media sites through the school. And if there is a change, they could certainly contact us and we can, help them figure out what the new dates would be. If indeed that happens, Sally, but I'm really not at all sure that's going to happen.
Okay. Yeah. And I mean, I think now that they have the live streaming capabilities in more of the schools where the quarantine kids can participate, that's been helpful as well, as far as not having as much disruption. Let's see, hold on. I should have written down the questions, but I didn't. Another question had to do with, I remember, I think it was last week when we got the breakdown of the positives in the school. It just happened to be a day where there were 3 in the in-person and 3 in the remote. Are you getting any information from the remote learners as far as how, obviously that's community spread, but is there any sort of discussion? Because it's obviously interesting on those kind of days, where it's in both populations.
Well, I mean, actually, there have been a number of remote learners who have tested positive. I mean, that's it. We do generally ask individuals where they suspect their exposure was. And for the most part, I think that we can assume that, remote learners, they may not be going to school, but they are participating in the community, either with friends or family. Parents are going out to work, coming home. They may be positive. I mean, there's a variety of reasons. We certainly haven't identified any pattern to it at all.
And then the last question I had is, I know it was kind of on the fence as far as the in-school transmission. I think one of the last times that you had talked, there was maybe one or two that were possibly even an in-school transmission. Has there been any more definitive data or numbers on that part where it was like the only place this person could have gotten it, just because the schools are being so diligent with the masking and as much, spacing as possible?
Yeah. Sans, you and I reviewed that data again, and I think, was it last week or the week before? I think we determined there were possibly 2, possibly 3 cases, but it is very, very difficult to say definitively that this is where, with this widespread community transmission, that this is definitely where the where the individuals were exposed and were infected.
Okay. No, I was just curious, just that there wasn't like some, explosion of cases in a classroom, for example, with everybody, following the protocols that you guys have put in place to be as safe as possible. I just kind of wanted to make sure there was no major change in that.
No, we
But,
haven't had any cluster outbreaks or anything like that. Certainly, absolutely not. Nothing like that.
That's good. Good to know, right?
Yeah.
Well, and actually, just to add to that point, I thought it was kind of interesting that so the couple of clusters that I've heard about, it's kind of interesting because they tended to be younger kids. They were in the same class, but after the contact tracing was done, they came to realize they were all part of the same sports team or some outside activity that where we actually saw the cluster. So if you didn't, if the contact tracing team hadn't been as diligent and thorough as they were, superficially it might look like, hey, wait a minute, 3 kids in a class that, they must be, transmitting the virus in the class when in fact it was outside.
Well, it could also be, the same 3 besties who go over
Yep.
one person's house and are like hanging out inside in an enclosed like bedroom or something, or basement playing. Okay.
Right. Yeah.
Thank
And I think the best, and again, please, we're all, clinical people, so correct me if anyone thinks otherwise. But I think, when you look at from an epidemiologic standpoint, whether, to Jill's point, whether we know that it's actual transmission or not. I mean, the way that the state and the CDC talk about doing it is you have to do a genotype, to figure out if in fact it's the same strain. But I think even in the cases that I've come into contact with or seen, you can still conclude with reasonable certainty that this is probably where they got it from. And sometimes it's in the school, sometimes it's not. So I guess it just goes to show that, we need to communicate to everyone that it's important to participate with contact tracing as best we can. So,
and the one thing I would add to that is, we did share, Jill and I did a review of the data and did share with Mike Cummings and the leadership team of the school where we were with that, in response to some specific questions we were asked, where at the time we thought there was two potential instances where it was one of the possible explanations, and since then I think there's one more that we felt like that was the case. And in a couple of situations it was, some of the things that led to that, suspicion is this: there were some, some things that could have been done better in the schools that were, in all cases changed, immediately upon finding that. But again, nothing definitive to say, it's these kids, hung out in school together, but they also hung out Friday night, Saturday night, and Sunday, some portion of that group. And so, it's very difficult to say where transmission actually occurred in that scenario. And that's been the case in a couple of those.
One question just outside of the school setting, but I know it came up at the last meeting having to do with testing sites. Obviously, we all know like since the last meeting, right? Everything really ramped up and, getting the tests, like scheduling that. Even one of my son might have seen it around, but one of them has a band, a high school band. So they, like classic rock band, but they do some music together. And one of the kids was not feeling well and he did get a PCR test, right? And they did not, come in contact at all, but the wait time was like 5 days, and so here was somebody staying outside of the school environment for that long. So I think there is still kind of some concern, I'd say, about accessibility to the testing. And, a lot of the appointment slots filling up, certainly around the holidays, right? People around Thanksgiving were trying to be vigilant. Oh, and that was another thing. And sorry, this is, I think, out loud sometimes. But one thing that seemed really positive on the graphs was that it didn't seem like it's almost like, given the fact we're on the 14th right now and when Thanksgiving fell, I mean, how are you feeling about that, kind of the responsibility of people? We would have almost started to see more spiking, right? If people were not mitigating during the holiday, right? I know that was a big concern. So I kind of have like a few layers of talking points there, but just thoughts on any of those
Yeah, so
aspects.
I don't think anybody's seen a large spike in cases, as a result of that. I mean, we definitely saw a large increase in testing, which leads to some increase in cases. But I've heard Dr. Carter from the state epidemiologist say, that we'll kind of wait to see some of the data coming out this week is when we'll really start to see sort of the bigger trends. This week's data, we should start to see, what happens with that cases, average cases per 14 days per 100,000 number. We're kind of waiting to see what'll happen there. So there's still some time in terms of what's happening, trending in terms of, as I've said numerous times before, the deaths and the hospitalizations are lagging indicators that come weeks after, 2 to 3 weeks after deaths, even more so. So we're still waiting to see on some of that. Some of the, as I said, there's some cautious optimism in terms of the hospitalizations, and that we haven't seen any large increases in the last week or so. But we're cautiously optimistic, but we'll leave it at that in terms of don't want to get too hopeful.
And any additional like testing pop-ups leading into the holidays?
We are looking, so a lot of the state contracted testing sites, testing providers are maxed out. They have all their days are filled with locations and spots. And so in terms of, they don't have more availability to set up additional testing sites, and so what we are working with, we've been engaging with Yale Health Systems to set up additional testing in town. That process just takes time. We've done 2 site visits of different sites. We're working with the state as well on another state contractor to come in and provide testing in Fairfield County. We're trying to secure a location in Fairfield for that testing site. That would be nice. But again, it really comes down to the contractor and the state. We're providing locations, and I believe there was a site visit at one of those locations with some of the state officials. So we're working with the state and testing providers to make things happen, but we're still some time out from anything definitive. It's just getting down to.
I think that's great, because I could see how somebody, if they knew they were waiting 4 or 5 days, that they might get restless, right? Or they might make a choice if they weren't waiting just like a 2-day period, and then that's when obviously more problems could occur. So, okay. Thank you so much for the updates. I think I'm done with questions.
Sally, I just wanted to add to that. At last month's meeting, I was talking about using the Binax Now testing for in-school diagnostics for symptomatic children. And I've done a lot of work on that and a lot of research on it. And unfortunately, I found that it wasn't approved. The FDA did not give approval for the Binax now for persons under the age of 18. So we did not go forward with that.
Okay, thank you for the update.
Great. Well, thank you. If there aren't any other questions, Sans, any communications?
I have none.
All right. Neither do I. Any old business anyone would
I
like
have
to
none.
discuss? Great. Thank you. New business. So we have done the election of the officers. The next thing is Sans had sent out a proposed calendar of meeting dates for next year. They generally occur on the second Monday of each month. There are a couple that have been moved to the third. Hopefully everyone's had a chance to take a look at that. August, we generally have no meeting in August. We can always call one if we need to. But we do have to approve these dates so that we can get them out. Can I get a motion to accept the dates as sent out?
Motion to accept.
Thank you. Can I get a second, please? Dr. Hotchkiss, thank you for a second. All those in favor say aye. Aye.
Aye.
Opposed? Abstentions? Great. Fantastic. Motion passes. And the next item is consideration of reappointment of Director of Health. So for those of you who are new to the board, at this point in time, we go into executive session where we discuss the reappointment of the Director of Health, which needs to be done on an annual basis. So
every 4 years.
Oh, excuse me, every 4 years. Sans would be very nervous if it was done on an annual basis. So yes, every 4 years. Can I get a motion to go into executive session, and then I'll ask the board members to stay on, and then I will, and obviously we don't record, and then I will reach back out to Ms. Flynn and Sans and Jill, and they can make their way back, and we'll come out of executive session. So can I get a motion to go into executive session, please?
Motion to go into executive session.
Thank you. Can I get a second, please? All right. Dr. Morose, thank you. All right, motion passes. We will, fantastic.
You would just need to note the time that we came out of it. You came out of executive session.
Oh, it is 8:48 p.m. We came out of executive session. Sans, you'll have to forgive me. I can't remember. Are we supposed to vote out of executive session or just make? Okay.
Yeah. So you vote outside of executive session.
All right. Well,
We just practiced, right?
yes. I have a sneaking suspicion I know how this is going to go. So, so can I get a motion to reappoint Mr. Franz Cleary as the Director of Health for the town of Fairfield?
I make a motion to support Sans, the Director of Health, to continue his health here in Fairfield.
Okay, thank you, Dr. Hotchkiss.
For the term of 4 years.
4 years.
For a term of 4 years.
And can I get a second? I think Dr. Morose, I saw you give me a second. Thank you. So all those in favor, if you please indicate by raising your hand or saying aye.
Aye.
1, 2, 3, 4, and I think Ms. DeSteno said there was an aye in there, right?
Yeah.
Yes.
Aye.
Okay. Thank you. If we can't see you, we'd love to hear you. So motion passes 5-0. Congratulations, Mr. Cleary, for your
Congratulations.
recommended
Congratulations.
reappointments.
I appreciate it.
Fantastic.
It's good to have a job.
Do you want this
Jill-
crazy job?
Jill, it was close. We almost like, Jill said.
I'm not eligible.
All right. Well, fantastic. So if there is no other business, if I can get a motion to adjourn.
Motion to adjourn.
Thank you, Ms. Connolly. Appreciate it. All right. Meeting adjourned, 8:50 p.m. Thank you, everyone.
Thank
Happy
you.
holidays, everyone.
Have a
Thank
great
you.
holiday.
Bye-bye.
Be safe.
Yeah, you
Yeah,
too.
thank you for all the work you're doing.
Bye.
Good night.
Thank you.
Thank you.
Bye-bye.
Bye.